You ready?
I'm ready. You're going to
You're
edit as well, though, right?
Nope, I don't
No.
edit.
Oh, shoot.
And we're recording. Are you
Alrighty.
ready?
Yep.
Yeah.
Yep. You said you don't cut, so I have to be ready. No
Boom.
editing.
You're a podcaster and all that's going in. And I am honored to announce to everybody that Allison from Walking with Warburg is officially on YouTube and she's building her YouTube channel. Welcome, Allison. How the hell are you doing?
I'm doing good. Thanks, Jason.
That's
Yeah, I know. I've been
awesome.
crazy nervous to post myself publicly, as you know. So other than having a blog, but I don't have any social media and
It's
afraid to go
already
on
over.
YouTube. But
It's
here we
already
are.
over. It's just already over. You're now a YouTuber and you're
I
live. So
am.
the jitters should be gone now. It's just like
Yeah.
playing a hockey game when they drop the puck. Right up until then, you're so nervous you feel like you're gonna barf, but once they drop that puck, the jitters are gone.
Yeah. I would say the jitters are close to gone. I have my coffee and all that. Painkillers will kick in and I'll be good. No.
So Allison, she runs a blog. I think we'll call it a blog, Walking with Warburg. She's well known in some of the social media spaces. She's a press pulser herself. And she has a heck of a good story to tell. And like I said earlier, I'm very honored to be introducing her to her YouTube journey. It's extremely honored to. I've been pushing her to do this, and
Yeah.
I'm glad that I was the first one that gets to interview her. So, Allison, you got a great story to tell, and I want to hear all about it. I want my subs to hear all about it. And if you're following me, she needs your help. Please go over to her YouTube channel in the description below. And please like and subscribe her first videos as she comes out and listen to her story today. So, Allison, why don't you start off telling us about when you were first diagnosed with cancer, and we'll go from there.
Yeah. So that's how I've met Jason here is kind of, hitting the YouTube spaces, looking for information. I've been doing a ketogenic metabolic protocol for over a year now. So I feel like I've had a good chunk of experience, but I was diagnosed with metastatic breast cancer in January 2023. And that started with a broken back and a herniated disc because the cancer had metastasized to my bones already. I'd had a lot of pain and had been going to the doctor. I've been actually going to physio as well. So my physiotherapist, we just assumed it was like, whatever. Not very good core muscles. So my back was hurting, the usual. But we couldn't really identify what muscle. And it got to the point where it was, it's not mechanical. Something was going on. And we had identified like where in my spine it was. And it narrowed it down anyway. It was like between the thoracic 3 and 6. And I'd gone to the doctor and no one could find anything. And one day it was so bad, I went to the hospital. I went in, I talked to an emergency doc. I was pretty calm. I'd been taking ibuprofen, which worked really well to cut down the pain, but I had to stay on it like 24 hours a day. And I talked to this emergency doctor. I explained all my symptoms. I said, it hurts when I breathe in really deep, but it doesn't hurt when I move this way. And I said, there's something wrong, something in between the T3 and the T6. And I thought maybe I'd like chipped a rib right at my spine. And I was really graphic and explained the whole thing. And he completely disagreed and thought maybe I had a pulmonary embolism, like a blood clot in my lungs. And I couldn't understand, well, that doesn't make any sense, right? I was like, well, why does it hurt why does the pain go away, for example, when I take ibuprofen? Like if I had a blood clot in my lungs, why would that work? And he decided to do a CT and see if I had a blood clot in my lungs. And I was like, will that show if I have a problem in my spine or my bones, my ribs? And he's like, yeah, no problem. So he does a CT. He rules out the blood clot in the lungs. And then he says, you also don't have any broken bones. You're not having a heart attack and you have no tumors. And then it was like 3 weeks later, I sat up in bed and just the position of propping myself up broke my back. It turned out I had a huge tumor in between the T4 and the T5. And the disc herniated. my back broke, and I was pretty much just paralyzed in pain. And you're from Canada as well. We're both from Canada, so we're part of the medical system here. I don't know how bad it is in Ontario, but BC is really bad. And I also work at the health authority here, and I have done so for almost 20 years. So I'm really familiar with the system. And being in emergency is the last place you want to be, regardless of whether you understand the system or not, you don't want to be there. But having seen it from both ends, I really didn't want to go. So I lied in bed for, I think, like 12 hours with a broken back in excruciating pain, refusing to go to the hospital. And I was like, nope, all they're going to do is pump me full of pain meds and send me home. That's all they're going to do. That's all they're going to do. So I just didn't want to go. I was like, I'll just call the doctor in the morning. I'll beg them for drugs, and I'll just take my own drugs and stay at home. Why go to the hospital and have them give me drugs if I can just stay at home and get them, right? So I did do that. But then I lied in bed for more hours, and the drugs could not even touch the pain. So I eventually went to the hospital, and that's when they left me, in the emergency room front door for another 12 hours. You know how it goes, right? Leave you there, and then eventually they get around to diagnosing you with a terminal disease. So that was kind of the beginning, and I was naive. Like, I don't know about you when you were diagnosed, but I guess I was naive in an innocent way, like in a way that I think most people who don't have cancer. You hear on the news that, oh, we've made such huge strides. Cancer therapies have come so far. There's miracle cures every day. This is what you hear, or this is what I heard. And I think that's pretty common. And so when I was diagnosed and I was told it's metastatic, it's stage 4, nobody used the word terminal. And I think they didn't, because in the medical community, that was obvious. But I didn't realize that a metastatic stage 4 breast cancer was incurable.
So did you at that point you're diagnosed, did they give you any treatment options, and did you take them?
Well, they didn't. Well, so I was in the hospital when I was diagnosed. A lot of people are just outpatients, right? They find a lump, their doctor, says, go get a mammogram. And so they're an outpatient when they're diagnosed. Whereas because I had been admitted through emergency and my back was broken, I immediately got admitted as an inpatient. So I was put up on the ward of the hospital and kind of managed that way. And so when I was diagnosed, I was an inpatient, and they immediately took care of like any kind of pain, all the issues I was having. And it was a house doctor who told me my diagnosis, not an oncologist. And so
Yeah, I was diagnosed the same way in the hospital.
oh, okay, yeah. So he's not really able to start offering treatment options, right?
But then you were referred to an oncologist, and
I
so
was, yeah.
at that point, what did they offer any treatments, and did you
Yeah,
take them?
so it took about a month, and then I saw my oncologist, and it was a pretty quick appointment, and he offered me almost a choice. So, and that's when I learned it was terminal. So I went through that whole first month thinking like, oh, maybe there's a chance. So I was pretty shocked when I found out, but he offered me either a choice of hormone therapy or chemotherapy. And what I learned is that there's lots of different types of breast cancer. It's not like one breast cancer is not the same as another. So mine is estrogen receptor positive, progesterone receptor negative, HER2 negative. So those are 3 different biomarkers, and they can be a combination of positive, negative. So you can have a whole bunch of different types of cancer. And depending on what biomarkers you have is what the treatment can be. So because I was estrogen receptor positive and HER2 negative, kind of the best option, or one of the best options, was a hormone treatment where they essentially stop all estrogen and hopefully that kind of stops the growth of the cancer. The other option was a chemotherapy called capecitabine, which is an oral chemo. And really, he said it was about 50-50, except that the hormone therapy would give me a much better quality of life. So I immediately jumped on the hormone therapy. I didn't even think about it. I was like, okay, I just want to start right now. And I think that's also common. I don't know if that was the same for you, but I do know a lot of cancer patients, the minute they're diagnosed, you don't take any time to think. And there's also this stress they put you under. Like they give you the impression that there's a dire need to make a decision right away. But the reality is, and what I've learned, and hopefully a lot of people learn this, and we kind of spread that message to other people, is you've probably been sitting with cancer for a couple years, right? Like for it to have gotten that bad without me even knowing, I mean, it's been growing in me for years. And, what was another week to just sit and think, you know?
Cancer's what I tell people is cancer is a psychological emergency usually, and usually not a physical one. So
Yeah.
I say that a lot to people. Some people though, honestly, they're diagnosed and they're dead in 4 weeks. I do know
Mhm.
people that happens to, and I have spoke to some people
Definitely.
that that's happened to. It's very rare. Most people have a week to just gather themselves and think. They
I
don't have to
agree.
rush.
Yeah, I agree. And I think that often when when it is those unfortunate situations where they're diagnosed and die, I think there's been a lot of clues along the way,
Mhm.
right? Where they've maybe been ignoring it, ignoring it, ignoring it, and now it really
Maybe.
is too late. I
Well,
don't know the majority.
maybe,
Yeah,
like, my cancer was extremely metastasized, like, if you knew like, I was so full of cancer, I had it so it was in my spine, my lung, it was esophageal cancer, so it was in my esophagus, it was in my liver, it was in my pancreas, and it was in every lymph node from my neck to my pelvis, so I was so full of cancer, and I had no signs, so and
yeah,
I was basically one of those people that I had to make a decision and get on it because
yeah,
that's a lot of cancer. I got lucky that I responded well to treatment. So I had no signs leading up to it, if you can imagine. And
yeah.
so I don't know that. I don't know that that's true. I think everybody's case is unique.
It's
But
true. Yeah.
anyhow, so basically you were
Yeah.
given
So
these options for treatment, so you immediately chose the hormone treatment.
yep. I
And
mean, that's what I'm doing that.
how long did
And
you do that for?
so I did that. So that was January 23. I started in February 2023. I responded right away, which was great. So it immediately reduced the tumor sizes, I should say, because I had what eventually ended up being considered an 11 centimeter breast tumor. And then I had multiple sites within my bones. So my whole spine, multiple ribs, my pelvis, sternum. Yeah, I don't know how many, like so many that they didn't tell me, oh, you have 23 or 202. I was told my bones look like sponges. So little holes kind of everywhere. Anyway, I responded right away and I could tell because I had a huge reduction in pain. I also got radiation to the T4, T5. So I had 5 doses of radiation right away. And I was told that was not curative in any way. It was just a pain reduction strategy. And because the tumor was kind of bulging and pushing on my spinal cord, they were worried that if it got through the spinal cord, it would head up to my brain. So it was about stopping that, reducing the pain. And it all worked really, really well. By June, I was off of all pain medication. So originally I was on like a hydromorphone, continuous, you know how it goes. And
Yeah, I had one
as
of
I started,
those.
yeah, as I started feeling better, I just came off of it as soon as possible. And I had been considering changing my diet. And the reason I had been considering that is because the day my oncologist diagnosed me and gave me my options and I had chose the hormone therapy, as I was leaving the room, I was like, so, what about my diet and lifestyle? Is there anything I should do to change my diet or lifestyle? Like, is there something else I can do? And he looked at me and was like, there's nothing you can do or eat that can change your outcome. There's no evidence that your diet will change your outcome. And when he said that, it was kind of like, wait a second. Like, don't all doctors tell you to clean up your diet and lifestyle? Like, why is someone telling me that no, I don't, there's no evidence that fixing your diet or changing your diet can improve your health.
So what'd
And
you do?
well, I started kind of questioning that, obviously, because it doesn't make sense. And I somehow always knew that cancer liked sugar. Like I thought that was common knowledge. Turns out it's not common knowledge, or at least it's not accepted knowledge. And I had
Well,
done the ketogenic.
cancer likes glucose, correct?
Yes, yeah. Cancer like glucose. Sugar turns
And
into
carbs.
glucose.
And
Lots of
carbs.
things turns into
Carbs
glucose.
are carbs are sugar too.
Exactly. Carbs metabolize into a glucose.
Yeah.
And so, yeah, so I knew that cancer loved glucose in all forms. And so, and I'd done the ketogenic diet before as a weight loss tool and thrived on it. It was great. I just went off of it because it required a lot of prep. And my husband at the time and my kids would I'd make all this food that was just ketogenic and then they'd eat it all. They'd wipe it all. So it just seemed like I just couldn't keep up with it. It was too much cooking and prepping. And how it was a full-time job, but I already had a full-time job, right? So I eventually stopped doing keto, but I never had an issue with it. So I just started thinking about how if cancer likes sugar and in keto you're restricting your sugar, maybe that would work. So I hit Google and I just started searching for evidence that changing my diet would somehow improve my outcome. And it didn't take long, but I pretty quickly started finding all of these papers about a ketogenic metabolic therapy. And I came across Dr. Seyfried's work and many others, and just dove into it. I didn't have the courage to start it right away, though, because even though I could see in the studies that this was a clear, strategy to improve your overall health, which will improve your overall outcome in managing cancer. When I talked to professionals, they would literally poo-poo the idea right away. Right. So I had a naturopath doctor who was like, oh, no, don't do that. There's evidence that ketogenic can worsen some cancers. And I was like, really? Because I haven't seen that anywhere. And she's like, oh, yeah, bunch of us get together every week and discuss it. And, our recommendations are not to. So, of course, that scares you. And then, I talked to another doctor, same thing, right? Oh, no, don't do that. There's lots of evidence. So I felt really conflicted. And my cancer had been managed, right? With the hormone therapy was working. Originally, I was told, okay, usually this type of medication. So I was on a hormone therapy and also a targeted therapy called Kisqali or ribociclib. And I was told by one doctor when I started that they see, and they said that it's not evidence-based. It's just their perception for what they've seen in the local cases at our local cancer clinic. He said most people respond really well for 6 months. And he said that's when it tends to kind of separate. And some people either continue to be responders and then the others, it stops working.
Yeah. So when did yours stop working? Is that when you actually did something? So basically you did nothing. You were aware of the ketogenic metabolic therapy treatment. So let's fast forward you here a bit. So then what happened?
Okay. So
there was obviously something that changed.
Yeah. So it was in that August, which was about 6 months from there. I had been getting good scans. All of a sudden I got a scan.
And you did nothing for 6 months in terms
No,
of
I was on the hormone therapy.
Well, but you did nothing in terms of applying metabolic therapy. So
That's
in
right.
August, all of a sudden, standard of care is no longer working. So then what happened?
I don't know it wasn't working. All I know is I got a scan where my lymph nodes blew up.
So standard of care wasn't maintaining the cancer.
That's exactly what I think. That's not how our medical system works, though. Our medical system is like, let's rescan in 3 months, right? So they don't necessarily call it quits right away. They're like, oh, let's rescan in 3 months. But at that point, I had already decided that I was healthy, and it was dumb to wait until I was on death's doorstep to try and do something different, right? So if the standard of care says we're not going to be able to help you, you are going to die, then obviously you have to do something for yourself, right? And
Fair
so
enough.
at that point, I decided I'm jumping 2 feet in and I'm going to do it. So I started the metabolic therapy, doing a ketogenic diet, and I was
In
doing,
August? In
yep,
August? And
yep.
did you stop taking the hormone therapy?
No, I didn't. I kept going
Kept going, okay.
for a couple different reasons. One, I love menopause. I know, sorry to all other women out there who don't like menopause. I'm maybe the only person who likes it. So I like menopause, and they put me into menopause early. Like, it's not a normal age. Was 45 at my diagnosis. So just getting thrown into menopause, not typically pleasant, but for me, it helped a lot. Right? It helped from a psychological perspective, just balancing my hormones. It just, no hormones was very balancing. And so I think my mental health improved a lot.
Good.
But anyway, yeah, so I was happy with that. I didn't have a lot of negative side effects from it, and I just didn't know. But I was okay combining the metabolic therapy with the standard of care. I don't have an issue with that.
And at that point, the metabolic therapy you were applying was just the ketogenic diet?
Keto, yep, started with keto, and then I layered in intravenous vitamin C. I was looking for hyperbaric oxygen locally in my city, and I was trying to get access to a glutamine inhibitor that I had read in multiple studies was kind of the best way to inhibit glutaminolysis, which is, as you've mentioned in your show before, one of the two metabolic fuels or fuels for cancer,
Yep.
glucose being the other, right? So anyway, it just so happened I had a friend who, when I was talking to her about looking for hyperbaric in my local city, she's like, oh, tells me this crazy story about a friend of a friend whose husband cured his cancer using hyperbaric. And he lives in the same city. So I called him up just to kind of find out, hey, where's your tank? Or what tank did you go to? And lo and behold, that kind of helped me get all the pieces I needed put together. And so it was September 24th, 2023, that I officially did my first dose of a glutamine inhibitor inside a hyperbaric tank while I was in a state of ketosis. And so that's just over a year of doing this. And I had amazing results right away. So September 24th was my first dose. And by December 13th, I had done a private pay PET scan. And they told me that my entire breast tumor was gone, completely gone. And I had remission in my bones. So, like, amazing story. And if you go to my blog, what those glutamine inhibitor doses were like, the side effects, the journey, how I took it, the results, I've posted all of that kind of on there. And yeah, I just kept going, acknowledging that this might be a coincidence, or it might not, but there was definitely a correlation. And I had decided when I started doing this that I don't want to be one of those.
So now we're into January. So from August till January. So sorry.
That's okay.
I need a minute.
August to January.
Hold on. So from August to January, you used full press pulse protocol,
That's right.
and you continued using your hormone therapy, and
Yep.
your results were optimistic in January now, 2024, I'm assuming that is,
Yeah,
right?
that's right. So January, so I had, and how the protocol typically works is it's a press and a pulse. I think you've described this to people. The press is your constant glucose inhibition, putting metabolic stress on the cancer, and then you're pulsing with a glutamine inhibitor and hyperbaric oxygen. And then you got to give your body a break, right? So take a couple weeks off, heal. This is pretty common in all types of therapy. So January, I was fully intending to continue.
Yeah, so this is a very complicated protocol. Did you do this on your own, or did you have any support in doing it?
No, for the most part, I did it on my own. And what I mean by that is I had done all the research on my own, but I did have help definitely at the beginning when I met the fellow who I was looking at for hyperbaric. So he had also done a press pulse protocol and had amazing success and had documented his journey, which is published online. So using that information and his experience, I put together a bit of a protocol, largely based on his, but where I felt it was appropriate, I customized it for me. And I think that's what everyone should do. We're not all the same person, right? So, and you've got to deal with your own comfort levels. You have to look at what your medications are and what the contraindications are. So just because, the science says this is what you have to do, you still have to look at how that's going to affect you, right? Not all meds can be mixed. So you might actually just have to skip something that the evidence says you should take, or you have to make a decision, right? Which one of these do I want to take? But if there's a contraindication, there's a contraindication. And sometimes they're minor. You might be willing to take that risk, and sometimes they're major and you may want to reconsider your options. So, I did things like that. I used my head because I work at the hospital. I have access to like Lexicomp, so I can go through and look at my drug contraindications and things like that. I also am a very open, honest person, and I don't believe that I need to hide this from the medical establishment. I know a lot of people don't want to talk to their doctors about this, whereas I'm like, hey, guess what? Let's talk about this. Have you heard about this? What about this? And I've told my oncologist everything, like everything. There's nothing I have not told him. I don't believe, and I might be wrong, but I don't believe, at least in Canada, that your oncologist can just fire you because they don't like what you're doing.
Mine did.
Yeah. I would like to hear more about that, because I don't believe they can just say to you, I don't believe in what you're doing and I don't want you as a patient. Like, I think
I called mine out on he missed growth in a 6-week scan. I called him out on it.
yeah.
And he did miss it and he didn't do anything about it. And so I called him out on it and he said, you are going to have to go to a new oncologist.
Yeah. And so
I ended up being transferred to a whole new hospital. They transferred me right out of the system to a whole new place. So I was transferred from Hamilton to London.
Yeah. And I could see that happening, but I think, like, from a legal perspective, they can't just quit you. Like, you're not just left like on your own, right? I don't think that's a possibility. And
in the States, it's definitely a possibility.
Yeah, exactly.
States, but mine, I was literally fired by my oncologist because he screwed up and I called him out on it.
Yeah.
So it does happen.
Yeah. Yeah. But that's for a different reason, right? Like, his ego got hurt, or
he didn't exactly fire me, but he let me go, essentially.
Yeah.
He didn't just leave me hanging. I still got chemo in the meantime, so I don't want to give false information, but he did have me transferred to a new hospital, and I do believe it was because he made a mistake and I called him out on it, and we had a bit of an argument on the floor. I called him out on it right on the floor, and he kept saying, his words were, any other oncologist wouldn't have done all this work I've done for you, was what he kept saying. And I kept telling him right on the floor, you can't speak for other oncologists.
Yeah.
You can't do that.
Yeah. And so, I mean, in that, it sounds like you've pointed out, right? You had a disagreement. And so in the emotional setting, he's like, I don't want to deal with you ananymore, right? But I think
basically is what it ultimately ended up happening, I believe. And it wasn't just like he said, you're fired. It did happen.
Yeah. But I do encourage people to tell their doctors and their oncologists everything they're doing, and for multiple reasons, right? I don't think they're going to help you, and my oncologist won't. He does not support my efforts, but he supports me as a person, if that makes sense. So he listens to me as much as he can, given that he has 700 patients. I'm not exaggerating. He has 700 patients, which means he probably doesn't even know our names, right? It's not until 5 minutes before the appointment that he opens up someone's chart and goes, oh yeah, this one. if he can remember that. I feel though that having been honest with him and literally I'm doing some crazy stuff, I think he knows which one I am, right? Because I'm probably the only one doing some of this stuff, which may or may not be legal, like.
Yeah. So you had
So
some support along the way, and you had some help from somebody that was already doing this protocol. So you got lucky. So do you
yeah, I
know
did.
that
Yeah.
if somebody's listening to this and wants to get started on a full press pulse protocol, where would you send them? Like right now at this point in time, for me, I would think some of the cancer forums, there's some pretty good ones on Facebook and stuff. I think that's a good start where you can find other people doing it to maybe build a connection with somebody. Is that maybe some
Well,
good advice?
I think that really what people have to do is do your homework first, right? And Seyfried wrote an amazing book. It's expensive, right? Let me grab it. Seyfried wrote this amazing book. Buy it, right? Don't buy the summary by Johnny Rocketmeyer. Don't buy that one. That's just Johnny Rocketmeyer does it with a lot of books. I think what he does, and I could be totally wrong, but I think he just has AI do a summary of the books and then resells them. But it's not the same as actually reading the scientific explanation with all the links to the various studies and the work that Seyfried has done. It's probably a couple $100, and I've heard people squawk about the price. But if you are going to do a full ketogenic metabolic therapy with a press pulse using a glutamine inhibitor and various glucose inhibitors and hyperbaric, $200 for your education is cheap. Like this whole protocol is going to cost people tens of thousands of dollars. And that's cheap. Like that's a small amount, right? So spend the $200 and educate yourself. That's the first thing I would tell people to do. And at the very least, they should spend like 100 hours watching interview after interview after interview with Seyfried, Dom D'Agostino, Peter Tia. Like there's tons of doctors out there with amazing content. And you start there. But going on to a forum where you've got 100 other people that don't know what's going on and asking questions is just a recipe for disaster, in my opinion. Like you really, you need to know a lot of how your body works, and you have to build some scientific literacy, as you've mentioned before, and as Seyfried mentions. Like if this is a self-prescribed protocol, it's going to be extremely rare to have any kind of medical support. I'm very lucky. I don't have medical support, but I have been prescribed like legitimate prescriptions for some of the medications I've wanted and needed. So for example, and you've mentioned to other people before, I try and maintain a glucose level of between 3.2 and 3.6 millimoles, which for the Americans is like 65 to 70, I think, milliliter per deciliter. That's not normal for your body to be able to do, right? Your body's trying to stay in a state of homeostasis. So if you are trying to push your glucose lower, your body's like, hey, wait a second. It's just going to make glucose out of proteins and fats to bring it back up to probably, I think, around like mid fours is where your body happily will stay naturally if you're, feeding it properly, right? So trying to push it under that, in my opinion, at least for me, needs medication. It needs some kind of intervention. My understanding from listening to some of Seyfried's interviews is that it's much easier for younger people to keep their glucose lower. The older you are, the harder it is. And that would be measuring healthy people, young to old. Let's not add in things like, other diseases, other illnesses, medications that are going to increase your glucose, pain, which is going to increase your glucose. So it really is a very difficult thing to do. And I take 1,500 milligrams of metformin daily. I take 10 milligrams of dapagliflozin daily. I also take 1,500 milligrams of berberine daily. Those are the three main ones I take for glucose. Berberine's not a prescription, but the other two are, and I am prescribed those. I also take ALA, which has some evidence for reducing glucose. It also is an antioxidant. So I really kind of at first didn't want to take it because they say antioxidants can work against you once you have cancer. So it's a hard protocol. Anyway, I don't know what got me onto that, but when you ask where would people start? Do your homework, educate yourself, and don't educate yourself by asking other people who are in your shoes, which are other people who are just starting as well, who don't totally know. Everybody's guessing and everybody's winging it, because I think you're going to waste a lot of time and you're going to waste a lot of money. And if you're like me and like you, we don't have any money or time. So it's unfortunate. So do your homework.
So that brings us up to January of last 2020, which is this year.
Yeah.
And then what happened then?
So in January, I lost access to my glutamine inhibitor. And even though I wanted to do another protocol, and why wouldn't I? It was working. I couldn't. So it was pretty much from January until end of June before I had access to that again. And during that time frame, I slowly started having my cancer grow back.
So were you still on the prescription, whatchamacallit?
Yeah, my standard of care.
Yeah, you were still on standard of care?
Yeah, I was still taking it. Again, just because why not? I mean, I didn't think it was working.
It could have been work. Well, it probably was.
I don't know. And that's the thing. Yeah, that's the thing. Like I'm not. There's a lot of people.
Well, you don't know.
Yeah, exactly. And there's a lot of people in this space who are like super anti standard of care.
And
that's not. That's not my position exactly. I think there is a time and place for the standard of care. I think there's a time and place for medicine. And I think there's a time and place to take a step back and say, what else can I do? What can I combine, or what can I do as an alternative, right? So it's
I just got off the phone with a friend that was given a few months to live, advanced stage 4 cancer. And he's now NED from standard of care in high dose chemo.
Exactly.
So it took him 2 years, but and he went the first year and a half non-responsive to chemo. So he went through 2 or 3 different chemos before they had one that finally worked. And once he had one that worked, boom, they can't believe it. It's a medical miracle. It happens all the time.
It does. It does. It does. I mean, I don't want to say medical miracles happen all the time, unless we were talking about like antibiotics, right? But I do think there is a time and place for standard of care, but I think you and each person needs to look at what their options are, and are those choices right for them. And I think the biggest problem is we keep deviating from January, but I think this is a more interesting topic anyway. I think what oncologists should be doing, or I shouldn't just blame oncologists, every doctor, everyone in the establishment should be doing, is telling patients that they have other options. And I think that's my biggest beef, is they say, this is what I can offer you. And what they are legally allowed to offer is the standard of care. They are not legally allowed to offer you or even suggest to you an alternative or a complementary action. And I think that is a real shame, because the ketogenic metabolic therapy in general is simply getting yourself healthier, right? It is about fixing your metabolism. It's about healing your body from the inside out. Now, why is that illegal? Why do doctors feel like they might lose their license by telling you, yeah, you know what else you could do, Allison? Stop eating carbohydrates, because carbohydrates will metabolize into glucose, and cancer feeds off glucose.
But there's no trials to show it, so they can't say it. There's no trials. There's no trials. There's only clinical research. There's no trials. And you need a trial for them to recommend it.
That's exactly my point. And that's my problem, is it shouldn't be, the system should not be, we shouldn't have created this type of system where
because
you
we sue people. Because we sued the doctors for doing what you're saying.
No, I
Yeah,
think
they've been sued billions of dollars over the years for doing what you're saying, so they can't do it now.
I
It's our
don't think
own fault. It's our own fault.
no, I don't think it is that. I mean, it is our own fault in the sense that society has kind of created this monster to protect
We
itself. You
did.
know,
We did.
yeah, but I don't think it's from suing. I think it's bigger than that. It's like the at least in BC, it's the BC College of Physicians and Surgeons that regulate physicians, and that's who holds the licenses for doctors to practice. That college is also who decides kind of what the rules and regulations and what the framework is for them to what that framework is for the standard of care. And in Canada, it's different again than the States, but in Canada, it's our federal government that doles out the money, but
bureaucrats.
it's each province that then decides how they manage their healthcare. And so in BC, it's that College of Physicians. And so they hold the doctor's license and they say, if you deviate from the rules we've established, then we're going to take away your license.
Yeah, it's bureaucrats.
They hold insurance. So they've got medical insurance through the college. So they're protected essentially as long as they do what the college has said they're allowed to do. If they deviate from that, it opens them up to one, getting sued, or two, losing their license because the college says we're taking it away. That doesn't happen often. And you can actually go on to the College of Physicians and Surgeons and you could look it up and you can see every doctor that's ever been penalized in any way. And I mean, it is blow your mind. I'm sure it's the same in Ontario, but you can look and see what doctors have done and not lost their license. And you're like, holy shit, right? If they can do that to a patient and still be fine, then why can't they just tell me to eat better? So that's what kills me about this whole thing is right from the beginning, patients should have options, right? You should be told you could do hormone therapy, you could do chemo, there's nothing else I'm able to offer you within the scope of my license. But eating well, having an active lifestyle, exercising, all will improve your health. Improving your health will most likely improve your outcome. There is no double-blind clinical study to show that this has happened, but we have evidence-based research to show that cancer cells thrive off glucose, right? There's no clinical study, but we have evidence that, frame the wording. I think the wording could be framed in such a way that they are able to offer you healthy advice without having to say, I'm going to lose my license if I give you healthy advice. And so, I would love to have that argument. I'd love to sit with a doctor and someone from the college and figure out why we are mistreating patients, right? Why everyone just gets to blame.
You'll never get that phone call. So I'm sorry.
Yeah, we'll see. Yeah.
But anyway,
so January ran out.
So you're trying to get, we'll see, you said. I said, you'll never get that interview. You said, we'll see.
We'll see. Yeah.
You're going to try to get it? You're working on it?
This is the magic of social media. And this is why I regret having avoided it for so long, because I also feel like in general, just put cancer aside, we're so top heavy in the world, right? We're run by corporations. They're in the pockets of the government. Doesn't matter what country you're in, right? There's lobbyists that are making decisions, and it's just a circular. And it just feels like nobody makes a correction or apologizes privately. That all happens on social media, right? I can't tell you how many times my dishwasher has broke down, even though I have a 10-year warranty. Sit and spin Maytag, right? Rogers, same thing for you. Or Fido, right?
Fido, yeah.
Dyson, I can't tell you how many products I've had that break and I cannot get a solution. I can't even buy a spare part. because they refuse to send the spare part because they've made it so that you can't, so that you have to buy a whole new, like
it's a ripoff.
It's a ripoff, right? And you can write them privately and they do nothing.
Nothing.
The minute you go on social media, it's this new whole like free advertisement for them. They send you a brand new coat and then the problem's fixed. It's like, but only if you complain on social media, right? So I do regret having not tried all of this sooner, but between you and I, Jason, if we can get a big following, maybe we can sit down with doctors.
We can
sit down with the college.
Maybe
they will feel like there is enough social pressure to answer questions from the public.
The problem with YouTube is that it's very internationally based. It's very hard to get a big following isolated to just Canada to be big enough inside of your own country to have a big enough impact. But on something like Facebook, even that's the problem with social media. It's all internationally based. It's so hard to get a big following inside of your own,
outside of your own language, maybe.
Yeah. Okay, so we got to finish up the story. So from January from January. Oh no, I'm not editing.
Oh yeah, you got to
January.
Chop it down a bit.
No, only a couple places. From January till August.
Okay, so from
you had
January, I ran out of my meds.
June. You ran out of meds.
I ran out of meds. My cancer started slowly growing back. At that point,
till June until now. That's the next period.
So at that point, I'm like, okay, so I had a correlation in September. Have drugs, do the metabolic protocol, cancers get smaller, and then run out of drugs. Cancer grows back. So it's not like, in my mind, it wasn't like, oh my God, this is for sure working, or oh my God, this is for sure not. It was like, holy smokes, there's a correlation, like holy smokes. And so end of June, I get my own access to a glutamine inhibitor. And July, I'm like, okay, I'm on it. I'm going to do another protocol. I had been maintaining a state of ketosis that whole time and trying to stay really low, but struggling. But I wasn't doing hyperbaric as often. It just felt, it was too expensive. I'll be totally honest, right? Like every second day in a hyperbaric chamber, plus the commute to get there, it's killer. And so I was mostly maintaining just a strict state of ketosis that whole time and having a very small progression. And that may or may not have been reflective of the fact that I was taking a standard of care as well, right? So, I mean, we don't know. I was taking it. Was it working? I don't know. Was it not? So I do believe, though.
It doesn't matter. All that matters is that it does work or doesn't work. That's all that does matter.
Exactly, right? And so, but I also...
It doesn't matter what works and what doesn't.
Yeah, what I do know... What I do know for sure, though, is that I am way healthier than I was before. Like, way healthier. Yeah, exactly. Mentally, I'm way healthier. Physically, I'm way healthier. I have lost some muscle mass, but that was almost by design, right? And I have been monitoring that. I get DEXA scans. I don't know if you ever did a DEXA scan too.
No, I know about them, but I haven't done one. I already know the answer to mine, and it's I continuously lose muscle mass because I have esophageal cancer. So there's no need to get a scan done to tell you something you already know.
Yeah, and you and I, and hopefully for others too, have a different beginning. I mean, I started this while I was still really healthy, whereas you had already been kind of abused, right? Your body had already gone through a serious battle.
Well, yeah, and I couldn't eat.
Totally.
So if you can't eat, how do you maintain muscle mass?
Different circumstance, yeah. So when I started losing weight really quickly, I was like, oh, I recognized right away that I'm going to have to manage my weight, because eventually, if I continue to lose weight at that speed, I will have other problems. So I've been getting DEXA scans to monitor how much fat I have, whether it's fatty liver or whether it's just adipose tissue, and also my muscle mass. So I do take things very seriously. Like I'm trying to monitor and manage as much as I can.
So from January, so we got it. So okay, we're finishing this up. Nope, not editing. So from June till now, you've been back on press pulse. You got your own source for Dawn. You've been pressing and pulsing now.
Yep.
Now, when's your next scan?
Okay, so, but no, the important part is I did do 2 protocols in July and August.
Okay.
And I struggled with my glucose the whole time, and I changed the way I was taking my glutamine inhibitor. I was taking it originally just a raw powder, putting it in my mouth, swallowing it. And I'm sure you've told people, but you lose 50% of the bioavailability when you put it into your stomach, because your stomach acid destroys about 50%. And then, like everything you eat, it gets metabolized through your liver and you lose another percentage, unknown amount. So what the eventual bioavailability of this drug is after you've eaten it, we don't know, but it's definitely less than 50%. For me, that was too much money to literally waste. And so I was looking for ways to improve the bioavailability. And it was probably a dumb decision, right? Because if when I was originally doing it, I was taking it as just a raw powder and my tumor went away, then what kind of dummy changes the way they do things? But I did. I did. And I decided that if I were to put it in an enteric capsule, the enteric capsule would bypass my stomach and it would open in the small intestines, which is where we think, or where we know, glutamine and other glutamine analogs is absorbed. So based on that assumption, it's fair to say that this particular glutamine inhibitor would also be kind of released into the body in the small intestine. So putting it in an enteric pill made good theoretical sense. And so I started doing that, and I did that for my protocols in July and August. The timing changed because I had to calculate, well, how long does it take? Like, it's called the gastric emptying speed. How long does it take for something to move from your stomach to your intestine? And then I had to figure out, well, how long is it going to take for that pill to then break down in the small intestine? And I ended up getting a scan in August, and I had a small amount of progression. So that was disappointing because I had gone into those 2 protocols acknowledging that the first set of protocols, I had a positive correlation. I was excited, right? Ooh, maybe. And then even though I ran out of the drug in January, which was crushing, and even though I started having progression again, which should be crushing, it still made me feel good in the sense that I was like, okay, there's another correlation with the ketogenic metabolic therapy and the growth of my cancer. So this third set of protocols was like the money kind of, right? It was like, so whatever happens here is going to be the truth. So when I had more growth, I was like, crap, like what did I do wrong? Or does this not work? Because again, we don't know. This has only worked for one human. The whole protocol has only worked for one human who went from metastatic terminal disease to, hey, I'm still alive and have no evidence of disease without the standard of care, right? So there's a lot of us doing this based on what's happened in the lab and on mice. And as you know, 99.9% of studies that work on mice don't work on humans. Yet here we are, it's worked on a human. And just a basic ketogenic diet has helped thousands of people reduce the growth of their cancer, right? Maybe doesn't work for everyone.
Slow the growth.
Yeah, reduce the growth.
I think we need to make that very clear because I find a lot of people say ketogenic diet is going to cure cancer. And let's be honest, even Professor Seafried says, no, it'll help manage your cancer. In all of his publications, it says 50% slow. They reduce the growth rate by 50%. That's a reduction in growth rate by 50%. The cancer is still growing. Let's make that clear.
Yeah, I've never looked into the numbers. All I know is
it's like 75% on a ketogenic diet and then 50% if you incorporate hyperbaric oxygen in a ketogenic diet. That's what the public Dom D'Agostino and Seafried's publications state.
Yeah, I'll be honest, I never looked at this protocol from the perspective of doing half of it. I only
I
ever
said that wrong. I said that wrong. It's 50% with ketogenic diet, 75% with hyperbaric and ketogenic diet. You never looked at this diet with what?
I've never really ever looked at this as doing it halfway. It was
No,
always,
you
I'm
have to
either
be
going
all
to do
in.
the entire thing, right? Like it never dawned on me to just do keto and hyperbaric. It was like, I'm going to do the full thing. And
It
that
doesn't
was my
work.
goal.
I'm glad that dawned on you because it doesn't work without doing the whole thing.
Yeah. And so yeah, so I never really looked into any studies or any papers or did any digging into like, what if I only did keto? I just know that there are thousands of people, because I've been in metabolic conferences with thousands of people, and they talk about their ketogenic metabolic protocols and how they have thrived, like absolutely thrived, and maintained their cancer and or slowed the growth, doing any of that. That's impressive, especially if you're not destroying your body with toxic medications at the same time, right? Or if you can even just do a ketogenic metabolic therapy and you're taking those toxic medications, but if you can reduce those medications and reduce the toxicity because you are creating a healthy environment in your body otherwise. Like there's just too many positive things that come from treating your body well. Right? There's no
So
reason not to do it.
on that note, there's so
Yeah.
many positive things that come from treating your body well.
Yeah.
We have to wrap this up at some point. So let's wrap it
And I
up on
have to,
that note. Is there any
so
final things that you'd like to put in? And I'll put in the description how people can find you. Any final thoughts that you want to plug in here?
my final thoughts are you should do this not as a final resort, but this is the first thing you should try. This is the
Agreed.
absolute first thing. You do not wait until you are sick and dying to improve your overall health. They
Agreed.
should immediately clean up your diet, reduce your carbohydrate intake immediately, start exercising. Like, even if you're going to eat crap, exercise after you do it.
Agreed.
And later, if you continue to manage your cancer, and even if you're taking the standard of care and you start to decline, I think it will still be a more pleasant trip if you're healthy going into it, right?
Agreed.
Letting your body be destroyed and then scrambling at the last minute looking for some last hope. I don't think this will work if you're nearly dead when you start.
Agreed. Agreed. Yeah, I think that's very important. I know a lot of people that start this protocol when they run out of standard of care options. And
Yeah.
I think this protocol would work best early on, especially in combination with standard of care. You get the greatest pulse on the cancers. So I couldn't agree with you more. Start this protocol today. Don't wait.
Yeah.
Best advice. All right. Thanks a lot, guys, for joining us today. Don't forget to like and subscribe. Allison, you're a YouTuber. Congratulations. See, it wasn't so bad after all, was it?
No, and I just rambled. You're going to have to edit it now.
Nope, not editing. Take care, everybody. Have a great day. Bye now. Thanks
Take
for
care.
joining me, Allison.
Thank you, Jason.